Hi, I'm Dr. Julie Steinauer, and today I'd like to talk to you about something that I'm seeing an increased prevalence in, and probably over the last couple of years in my business. I just looked at some statistics to see what the increased prevalence of amblyopia was, and it used to be about 1% of the population. As of last year, Google reports it at about 2 to 5% of the population. Now, what I see in my practice is probably closer to 30% of the population. Now that's a staggering difference between what's actually reported online and what I'm seeing in my clinic. And even though patients are coming to me specific with vision problems, it speaks that there's a greater issue going on worldwide that we probably need to be looking at. And so today I want you to understand a little bit about amblyopia. This is an eye chart for up close. I'll hold it up here for a minute so we can focus in on it. Okay, so someone who's amblyopic might see one of these smaller lines of letters with their better seen eye, but then they may struggle to see that big E on the very top with the amblyopic eye. And so that's a huge difference between how they're able to see with one eye over the other. The amblyopic eye, by definition, is an eye that didn't develop eyesight well. There can be a lot of reasons why this happens, and we can maybe kind of just be guessing, like, what is causing this increased incidence of it? Because it's not something that you just develop. Like, you don't develop at age 3 or 4 or 5 to be suddenly amblyopic. You actually have to be amblyopic really from birth, and it's tricky to find this sometimes in some kids unless they're getting properly screened. With actually not just a pediatrician's office or a school screening, they typically will need to see a vision doctor who's specifically looking for this. So why the increased prevalence of amblyopia over the years? Well, there's a lot of theories out there. I'm going to say one is I don't know, are we seeing a lot of incidents of children having a cord wrapped around their neck in utero? Are we seeing a lot of genetic predisposition because mom and dad had this and they're passing it on? So there could be many reasons, but I can only report that in my clinic we're seeing a larger incidence of this on a regular basis. And for more information about how we would treat amblyopia, go to visionforlifeworks.com. Thank you.